Hello and welcome to Coping with COVID. I'm your host, Bryan Mulligan. On this program, we're here to tell the stories and share some of the successes of people and organizations as we all deal with this COVID-19 pandemic. Our focus is to keep people safe and at the same time, re-energize the economy. Our guest today is Kerry Armstrong, who's, amongst other things, chairman of the Atlanta Regional Commission. So, welcome, Kerry.
Thank you, Bryan. Great to be here.
Thanks for joining me. You wear a number of hats, but we're going to focus today on the Atlanta Regional Commission.
Great.
Which involves two things and two stories maybe you can share with us. The first one is, as an organization, how is the Atlanta Regional Commission dealing with COVID, and what are you guys doing, and what's your plan?
Well, we kind of look at it in two buckets, so to speak. One is internal. We have a staff of over 200 people, and they are very important, and they are scattered around the region, and we have to continue to operate safely and protectively while the pandemic is underway. And the other bucket, of course, is what we do for the community, which in many ways is critically important as all of us deal with this crisis. So speaking internally, we were actually in fairly good shape because we already had a teleworking component within our organization. Several of our employees, virtually all of our employees, could telework and had the technology to do it successfully. And we also managed Georgia Commute Options, which is all about teleworking and commuting and all of those things. So we had a lot of the information and data that we needed. So as soon as the pandemic became one, we very quickly sent our folks home. Did that very early in March and said, until further notice, let's all work from home. And since we were already tooled up to do that, we were able to make that happen very quickly.
How has that worked for you in terms of productivity or sense of community or sense of office culture and things like that? Any lessons learned there?
Yeah, generally good. Productivity-wise, we in many ways are more productive and have been able to do some more robust work related to the pandemic. So we see really no issues with productivity. However, we are a collaborative group, and we are accustomed to working together and working in teams. And having everyone working from home and distantly, we had to really focus on communications and how we keep that pace up and make that simple and easy to do. And we miss each other. You know, all the folks down there are friends, co-workers. For some of them, it's their family. And so we have to be very sensitive to those issues and make sure we're looking at it from a macro perspective, but also on a person-to-person perspective.
Have you put any thought into reopening the offices and when that happens? And
we have.
And is it compulsory or is it voluntary? What's your thoughts on all of that?
We have. The first answer is we have. The second answer is maybe. The first answer, we're following the data very clearly from public health officials and making sure that we have a trend line that says that we are in a safer phase of the pandemic and its lifespan. By our estimation, we're going to need the rest of June to get to that point. So we have announced to our staff that we will continue teleworking until the end of June, and then we'll revisit the statistics. We're monitoring them daily, but we'll revisit the overall question at the end of June and make a determination then about what's next.
So what I hear you say is sort of you've got a 3-month plan that you're revisiting every month and letting folks know.
Yeah, we're doing it on a month-to-month, sort of a month-to-month basis, just so people can plan ahead. We have all re-engineered our lives to deal with working from home and having our families with us, our kids with us, and all of those things, and you can't flip that switch successfully to go back any easier than you could to close it down. So we wanted to give people a no sooner than date so they could at least plan around that on their calendars.
And as far as I know, that the ARC, Atlanta Regional Commission, is the Metropolitan Planning Organization for Transportation. Any effect of the reduction in transportation on gas tax and revenues, and how are you seeing the future as far as what the ARC does? Are there any lights at the end of the tunnel emerging that aren't oncoming trains?
Yeah, we think so. Things will be different, and the degree to which they're different kind of depends on how the rest of the story plays out in terms of vaccines and so on and so forth. Traffic's great. We jokingly say, look at all the improvements we've done in traffic in the last 60 days. Air quality is much better because we have fewer gasoline engines out there on the roads day in and day out and hour by hour. On the other hand, of course, the economic hit that many of our businesses taken is very real, and it's going to take a while to get back through that. We do think, though, based on a survey of nearly 3,000 executive, middle management, and workers in the metro area, that teleworking is going to catch on. It has caught on. Companies are going to come back, but most of the major employees that we're talking to are saying that they've proven it does work, and so that'll be part of their mix as they go forward. Now you lay that against an ever-growing population, and we'll see how it all plays out. It might be a net wash for all we know, but good and bad, but things will be different when this is over.
That's actually quite an interesting insight, in that the new normal, as folks say, is going to include increased teleworking. Mm-hmm. That's your perspective, and so that surely changes your projections about how much roadway is required and transit and things like that. Is that starting to factor into your models, or are you guys still looking at, gosh, this is interesting, we just know that it's going to change, we're not quite sure how much yet?
Both. I mean, we can model it the way it was, we can model it the way it is, we can model it based on projections. But in terms of the major mobility efforts that the state has underway and other things, those are continuing. We think we're still going to need, certainly, roads and bridges and capacity. The demand for future capacity may be different. The growth in demand may be different. And all you can do is really see how we all decide to live our lives and make wizened projections based on that.
I think that's a great positive message, which says that yes, it's going to be different, but this great American economy is going to continue to function, and going to continue to function well as we effectively learn to live with the pandemic.
Sure, I think that's exactly the case. We're all getting better educated. We're all proving to ourselves the hard way that we are resilient and that there are solutions. Sometimes they're painful, but working together we can figure it out. And it takes time. I mean, we'll have to, it'll be a trial and error, but in many respects, but we have learned to be dynamic. We've learned to be flexible, nimble, resilient through this. And I think as citizens of the metro area, we'll adopt a lot of that internally and carry it forward, which is all good in my view.
That's great. One of the things we do at Applied Information is we turn data into information. And one of the segments that we're going to do on this show is each time just look at a particular set of data or a particular factor and drill down into what is that data trying to tell us. And one of the things, the thing I'm going to talk today about is mask wearing. I've brought some props of a thermometer and some hand sanitizer and a couple of masks. And the interesting thing of the mask wearing is, well, just how well does it work? And what you'll see is some really interesting research done out of the University of Hong Kong, where there's a factor called the transmission rate. And there's this interesting graph over here, which is the transmission rate based on the percentage of folks who wear masks and how effective those masks are. Now, a lot of folks say, oh, well, why should I wear a mask when somebody else isn't wearing a mask? I went to the store and there were 3 people not wearing a mask. And what this research shows is just how effective mask wearing is, even when it's not universally adopted. So what this shows is that if you get 70% of the folks wearing masks, and even if the masks aren't very effective, they only catch 70% of the droplets, and we know from the research that the virus is transmitted in these water droplets. What this shows is that the transmission rate is less than 1. So what that means is that in time, the pandemic will die out. And so we like to talk about risk-reward, and mask wearing really seems to be something that has a high reward for a low risk and a low inconvenience. There are other things like social distancing and some of the other data we'll tackle on another show, but this was kind of really interesting that what the data shows is if you're unsure, wear a mask. And so on that note, I'd like to thank Kerry for joining me on the show and for sharing his insights and his positive message about how we're going to both keep people safe as well as re-energize the economy in times of COVID. So thanks so much for joining me. Until next time, stay safe, stay healthy.